Good evening and welcome to A Deadly Silence. I'm your host, Larry Curtis, and it is the goal of all of us associated with our program to bring you current and educational information surrounding the alcohol and drug epidemic, not only here in the city of Brockton, but throughout all of our South Shore communities. This evening, we are pleased to have back as our guest again, Kevin Rosario. Kevin is from Gosnold, and he is a regional outreach representative. And Kevin, Gosnold is an award-winning, nationally accredited, not-for-profit addiction and mental health treatment provider with programs and services that address addiction at every stage. Those stages are prevention, early intervention, treatment, and recovery management. Kevin, welcome back to A Deadly Silence. It's a pleasure to have you back.
Thanks, Larry. It's good to be here.
Last time you were on here, we had a fascinating show. We talked a great deal about all of the many roads that are traveled in the addiction and recovery arena. But I'd like to maybe spend a little bit of time talking about the future direction that Gosnold, and I know that Ray Tomasi, who is your president, has a vision as to where addiction recovery needs to be going into the future. Can you talk a little bit about that?
Sure, I'd be happy to. I think one of the things, the biggest thing, is really raising awareness and education around the fact that addiction is, in fact, a chronic illness. It's not a matter of choice or morals or willpower, and we need to really get the world, the country, to buy into that. If you can get them to buy into that, then that opens new doors. You hear a lot about, we need more beds, we need more beds, we need more beds. And clearly, right now, we do need more beds. There's a lot of people suffering. But the beds in itself are not a solution to the problem. Ray often talks about the bookends of treatment and recovery and all that stuff. And that's those very things you talked about. Like, first, the one bookend is like, how do we get in front of it? So early intervention, and even before that, prevention. You know, currently, give a shout out to our prevention department, Patty Mitchell-Costas. Like, we're in 17 different schools on Cape Cod, from elementary, middle, and high school, and we got a Gosnold clinician in there that's seeing students at all different ages for various reasons, and really trying to help them at that early age. Often you hear someone come into treatment and they'll say, I had my first at 12, 13, 14. That's the most popular first-time use age. So we know...
And that could have been alcohol, it could have been a cigarette, it could have been a prescription medication.
That's why I left it blank. Yeah, it could be any of those things. Yeah. So, like, really, how do we get in front of it? We get in front of it by getting to the younger generation and catching early on behavioral stuff, anxiety, depression. There's trauma. There's things going on at home. And the young people, left untreated, left unsupported, quite often end up going down that same road. So we've been able to bring, like, some of our Gosnold recovery managers into the high schools, into the middle schools, and give awareness talks. And they'll share a little bit about their story and talk a little bit about the way the brain works and how, fragile the limbic system is up until the age 25 or so, and how, like, the earlier you use, the higher at risk you become to become addicted because the development of the brain. And really bring science in. I think prevention is really important, to bring facts. I've done it too. I go a lot to speak at high schools, and you're looking at a 15-year-old kid, and you tell him, don't do drugs. You're going to die. You'll become a heroin addict. Kid looks at you like, shut up, old man. It's so far-reaching. It's so out of control. Like, they don't even buy into it. Although we know people as young as high school that are already using prescription drugs. But some of them are just like, yeah, whatever. So you got to come from more of a scientific or factual approach and say, hey, look, I know this probably is crazy to you, and I'm sure a lot of you are good kids and will never do drugs, but this is what it looked like for me. When I was 13 or 14, I smoked a joint, I drank a beer, and it helped me fit in, and it helped me with my ADHD or my anxiety. But the bad news was, like, over time, that progressed, and I needed stronger weed, and then it was prescription pills and hard liquor, and over a period of time, we've become people that we said we'd never become. And you give them a little bit of your personal story, and we bring our coaches in. One was like a high school athlete. The other one was like, this homeless guy in Lowell living under the bridge in Revere, wherever he's from. He's from Lynn, Christoph. I don't want any problems with Christoph. But like these dramatic, crazy stories, and then like this rise into recovery. And you share these different perspectives with these young students that a teacher just can't provide. They don't have the curriculum or the experience to give them that, and you tell them about, like, making good decisions. So it's like, hey, we know you're probably going to drink a beer or smoke a joint sooner or later. So I'm not going to sit here as the old guy lecturing and tell you don't do it. Can we at least wait And let me tell you why to wait. And, and it's that part of the brain that is responsible for reasoning and common sense. It's the reward circuit of the brain that is so susceptible to chemicals early on, whether it's marijuana or cigarettes. It affects that part of the brain.
One of the challenges that we're seeing, particularly in the middle school and high school areas, athletics. Obviously, these young men and women are going out there, they're, executing in their athletic skill,
right,
but they're being injured. And immediately you go into an emergency room, it's almost like they're giving the pills away like it's Halloween,
right,
candy,
Right.
What should the parents be cognizant of about, the fact that, your son or daughter may be prescribed a pain medication for whatever the injury is?
Right.
What should they be aware of?
I think they also need to be aware of the addictive nature of prescription opiates. So, there's a lot of different factors that lead into addiction, and that's part of the prevention and education stuff is there's a genetic predisposition. So if your family has heart disease or diabetes, it doesn't mean you'll get it, but facts show that you're at a higher probability of getting it. The same could be said about mental health or substance use disorder. If it's in your family anywhere along the line, you're at an increased risk compared to the student that doesn't have that in their family tree. Then there's also emotional stuff, the ADHD, the trauma, the depression, and those could be driving factors to addiction. So when you remove the drug, you have to deal with that. But a normal kid with no genetic predisposition, with no mental health issues, from a great family in a great community, gets prescribed an opiate for an injury, and by the nature and chemical composition of that drug, will become addicted. Because there's a part of the brain that the opiate receptors, they release these natural endorphins that make us feel good and help us resist pain or tolerate pain. And when you put a Percocet or an Oxycontin into your system, what happens is there's more of that in your system than is needed, and the part of the brain that naturally produces that shuts down. So now your body becomes dependent on that chemical just to feel normal. And withdrawal is actually that. Withdrawal is the period of time it takes for your body to remove the unnatural chemical and start re-regulating the chemicals that it needs just to feel normal. And then if you've got other mental health and underlying stuff, then you also have to deal with that. So it's very dangerous. Most kids don't need Percocet. You don't need a Vicodin to pull a tooth. I mean, I just had ACL surgery, all right? I completely tore my ACL. They went in, they cut a piece of my tendon, my hamstring, from the inside of my leg. They drilled a hole through my knee, took the other ACL out, replaced a new one. I couldn't get off a couch for a week, and I never took a Percocet, And they were like, you need to take a Percocet. And I'm like, I don't think you understand. I'd rather not take that risk. And I told them where I work and my background. And they were able to give me other non-narcotic stuff. And it was less intense, but it was still risky. And it was like Ultram or something. And I took it for 3 days, and that was it. And I got by on Tylenol and Motrin. A major surgery like that. I couldn't walk for weeks. I was in rehab for months. And I got by with Tylenol. So you're telling me you can't pull a tooth without a Vicodin? And you have to be an advocate as a mom and as an individual patient when you go to say, no, I don't want it. And sometimes you'll find that they try to push it on you. So new laws have been passed, which are also cool around that. First-time pain prescription patients get no more than 7 days, and then they have to go back and be reassessed. If you get prescribed 30 days or a 30-day supply or whatever, you can tell the doctor, look, I'm in pain now, but I think I only need 11. And he has to give you only 11. And if you run out and you need more and you call him, that's what it is. But so some laws have been passed in a way to protect patients and to reduce the amount of pain pills that are out there. Another thing...
Because those pain pills that don't get utilized sit in a medicine cabinet, and who knows who's going through your medicine cabinet.
We have a big thing on Cape Cod called RX Take Back Day, and it's a national thing, but we as Gosnold really engage with the police departments and the schools and spend a lot of energy letting people know, hey, you can bring any unneeded prescriptions, whatever they are. It doesn't have to be just pain meds. If you got a prescription just collecting dust, get rid of it. And you can bring it to kiosks, you can take your name off of it, or you can dump it in a bag and be done with it, because 72% of people addicted to heroin report that the first drug they tried was a prescription pain medicine from a friend or a family's medicine cabinet. So the bookends are really, just to get back to the original question, is like, you got to get in front of it. You got to educate the kids. You got to educate the families. We have 5 family support groups that are free, run by a Gosnold clinician. The closest one's in Situate from here, and then there's some on the Cape. And we want to educate people to curb the addiction, and we want to educate youths to try to avert and avoid addiction. And then early intervention is like, if you see it, do something about it. Don't wait. Don't be scared. If you see signs of someone being addicted, things are missing, they're lethargic, they're slurring, their eyes are pinned, they're nodding out, whatever it is, seek help, talk to a professional, get guidance, and call them out on it. Don't wait until it gets worse. And then the other side, the other bookend is, how do we keep these people engaged in long-term recovery? So an acute stay in detox or rehab, it's 28 days, 30 days. Maybe you go to residential for a couple months, and that's great. That's really going to give you an upper hand because detox is not enough to solve the problem. But even if you go to treatment for 6 months, eventually you have to go home. And the other bookend is long-term recovery management. How do you give people tools that they need to be successful? And the tools change. You know, when the guy first gets out of treatment, he needs to find meetings. He needs to find a therapist. He needs to find a gym. Like, there's all these immediate needs. Maybe the person needs to get food stamps or an insurance card or a license or whatever. And, like, you got to address the immediate needs. And then as they progress in their recovery, all of a sudden now they got a part-time job. Now you got to help them manage their time. Then they have a full-time job. You got to help manage their money. Now all of a sudden they got the girlfriend or the boyfriend. Now they got the apartment. So, like, as they progress in their recovery, more stuff gets put on the plate, which puts the recovery stuff out of balance. One thing Christoph taught me early on, and he said, recovery is like this. When you come into recovery, you got to build a foundation. And your foundation might be different than my foundation. We'll work with you on making a solid treatment plan for you. Whatever that is, doctor, dentist, counselor, therapist, 12-step, the gym, going to church, you know, mind, body, spirit, yoga, meditation, whatever, Pilates. Let's find a system of things that are going to help you support your recovery. And you're going to have to do that for a good 90 days straight before it becomes a habit. And then, whatever you want to add to that, whatever you want to bring into your life, make sure it fits. So I got the girlfriend, I got the job, I want to go to school, I want to do all these things. If it doesn't fit like this, it's not going to work. This is what happens. They get out of treatment. Or the girl, the job, the kid, the dog, wrap probation, get all my stuff out of pawn, and they get all this stuff, and they're like, well, I'll squeeze in a meeting over here. I'll go to therapy once a month instead of every week, and I haven't been able to go to the gym because now I'm working 60 hours a week because I want all this stuff. Very rarely are they successful. The people that you see in long-term recovery, they have a system, whatever it is. It looks different for everybody, but they found a way to be happy, to find peace. Recovery is not about not using drugs. Recovery is about, okay, the drugs and alcohol are gone. How do I find a way to be successful, happy, have purpose, and deal with life? Life's still going to happen. People are going to die. Relationships are going to fizzle. Are you going to have the tools that you need for when the storm comes? Because it's going to come. And if you have that solid foundation, then after that, you can do anything you want in life. But the foundation has to stay in place.
So as we're looking at the bookends, really, we're talking about early education and prevention to the young men and women that are coming up through the elementary, junior high school arena.
Right.
And at the same time, there'll be the spectrum of services that are available through a treatment center such as Gosnold has. And we'll talk a little bit about those steps as you go through. But then more importantly, on the other end, where you think you've reached the goal line.
Right.
There's still a lot more work to do,
right.
You know, and to recognize, as you said, the added burdens that might come along
right.
and take you out of the focus of your recovery.
Yeah, the natural progression or the blessings, you might say, of being in recovery actually take people out of recovery. So they finally get their stuff together, they're kind of stabilized, and then all these great things that they thought they always wanted, they come in, but they mess the mix up. So they need sometimes help and guidance around, you know, how to keep that going. So the recovery management program that we have has been really successful with that. And I worked with the guys personally. I'm a nationally certified recovery coach, family coach, interventionist, and before I moved into community outreach, I did that. And we call the patient 5 days a week. You meet them twice a week face-to-face. You bring the family in once a month, and goals change and treatment plans change. And, like, I followed a guy for 2 years. You know why? Because the first 6 months was really about recovery. Then he got the girlfriend. Then he got a house. Then the girlfriend got pregnant. Then he got a full-time job. So the drug and alcohol thing was really kind of under control at the moment, but he was stressed out. He was awful with his money. He wasn't doing good self-care. He was working too much. He wasn't sleeping. So he needed a lot of help and guidance around just life stuff. And mom needed help and guidance about boundaries. Let them make mistakes. Let them raise the kid. You know, had to keep. So it's a really dynamic that things changed, but the recovery management team was still there to help them, support them through them changes. And the kid's doing great now. He's got like 2.5 years, and they got a healthy baby girl, and they got her 3-year-old daughter.
And I think that's an important aspect, too, that the loved ones of the individual that is in long-term recovery today need to recognize that there are limitations and guidelines that they need to recognize and stay within as well,
Right.
for their own
Right.
mental health,
Right. Yeah.
out there as well. What are some of the programs that are available in Gosnold? For instance, if an individual that makes the decision to come into Gosnold, kind of walk through the progression of
Okay.
programs available.
What's really cool about Gosnold, besides the prevention work, it's so amazing to be out there and be working in the schools and trying to make a big difference. That is all goodwill. That's not something that generates revenue. That's like trying to make a difference in the community. We're a not-for-profit, and we want to make a difference in our community. That is amazing. That separates us from what almost anybody else is doing, that piece. But the continuum and the way that we bring the families in and educate the families really makes Gosnold special to me. That's why I'm so passionate, and I get all crazy and fired up, because I really believe in what I'm doing. And what's nice about Gosnold is you can enter one door and be in one system of care for a year, 2 years. You come into detox, and the detox is really just the acute stay. Medical necessity could be like 4 to 6 days, and then you're looking for clinical stabilization or rehab. We have Gosnold at Katomet, which is a 3 to 5 week inpatient program. You stay there the whole time. It's co-ed. We're in network with insurance there. And they do an array of different groups to give people different tools, cognitive behavioral therapy, mindfulness, yoga, 12-step. They do meditation. They have a little gym there. They got master's level clinicians at night. It's like an executive chef. They put out the tablecloth and the food is good. And the idea is that if someone's uncomfortable in their surroundings, it's going to be hard to keep them there. They're not going to want to stay. So it's like, make it aesthetically pleasing, make the food decent, have a staff that's educated and compassionate, and then you have a better chance of the patient wanting to stay so you can help them work on some of the issues. That's typically 3 to 5 weeks, and then they would move on from there. And we have Emerson House, which is a 37-bed women's program. What's really special about Emerson House is we have 10 beds for pregnant and postpartum women. So there's not a lot of treatment facilities that'll take a woman that's pregnant, that'll take a woman that's on medication-assisted treatment. Oftentimes, it's not safe to detox a pregnant girl or woman, so the doctor will prescribe a medication-assisted treatment, and that limits the places she can go. So we can help with that. Average length of stay there is probably 2 to 4 months, but we will take a pregnant woman who's 2 months pregnant and see her through her pregnancy. She could stay the whole time. And at that level of care, they get a little more freedom now. They're in a house out in the community. Emerson and Miller are like beautiful properties. One's like a Victorian old mansion, and this other one's like a beautiful summer home in Woods Hole, the men's house. But they bring them to the morning meeting every night. They bring them to a night meeting. They encourage them to build a recovery network. They start going to outside appointments. During the day, they do a variety of groups. They keep them busy all day. It's pretty much a non-working program. It's a treatment program. It's not a sober house. Towards the end of their stay, if we know they're moving on to recovery house, a sober living, we'll help them get a job so that they make a smooth transition. But typically, we want them to engage in the services that are there. All the food is provided. Transportation to all appointments are provided. We have a guy that does life skills training. Adam, he does a really good job with that. And you meet a person where they're at. Again, 22-year-old never had a job, 60-year-old CEO. He has different needs, and he can sit down with that person and help them come up with a game plan, whether it's like time management, family integration, or like a young person might never have done a resume. And he really works with them at that level, and we still help make things easy for them and provide the transportation and the food. So from there, you could go to one of our sober residences. We have 2 men's houses and 2 women's houses at different price points with different options. One of them is like a basic recovery house, and you got to get to your own appointments and your own meetings, and you can get a job, and it's supported and run by Gosnold, so it's safe. You got chores, you got curfew and random testing, but you have a lot more freedom. People too often want to go from detox to a recovery house. Recovery house is not really treatment. It's a safe place to live, but it's not really treatment. Ours are a little more intense because we have the Gosnold clinical umbrella making sure things are okay there, but that's not, you want to go through a system first. Go to rehab, go to residential, give yourself a couple months to start to feel better and let the brain heal a little bit, and then you can continue on in the recovery houses. And one of them that we have is like a little more inclusive. It's a little bit more money, but Stop and Shop Peapod, food is included, transportation to medical and clinical, case management. We got a studio on the property that we're doing yoga and exercise and music classes. So you get more, you get what you pay for. It's a little bit more money, but it's a step down where you still have a lot more clinical support. So that's basically the different levels of care. And then on the outside, we have 7 outpatient sites. We have one right here in Brockton on Torrey Street. We'll be expanding and moving to Stoughton very soon. Stay tuned for that. Partial hospitalization, IOP, SOAP. It's going to be a great facility and have more services to better serve this area, and we're really excited about that.
And IOP, for our viewers, is basically intensive outpatient services.
Yeah, I take it for granted sometimes.
Okay.
PHP is partial hospitalization. It's 5 days a week, 6 hours a day. Lunch is included. Intense grouping. It's usually intense groups. It's usually like 2 weeks, 3 weeks, depending on insurance. Some insurance will pay up to 4 weeks. IOP is 3 hours a day, typically 3 days a week. You can do day or night, and there's a mental health component there, so they can help you with medication management, and there's like a dual diagnosis or co-occurring disorder there. And then SOAP is structured outpatient program. It's specifically for someone with straight substance use disorder, maybe no mental health, and it's a good step from after being in structured programming to have something to do. Some of them go home, they got no job, and they have nothing to do with their time, and that takes them out. But you don't have to go, I think it's important to say this, you don't have to start at any particular place in Gosnold. You may never need inpatient. You can just go see an individual therapist. We have one in North Dartmouth, we have one in Brockton, and we have 5 up and down Cape Cod. You might go somewhere out of state and still be able to come to us for rehab. Or, depending on appropriateness, you screen every patient, but you don't have to start somewhere to get somewhere. You can enter any one of our levels of care, recovery houses, rehab. You can be referred in, and if it's a good fit for you, we can get people in.
That's where your clinical team will come together, working with the individual, working with the family, and laying out an opportunity for that individual to make their choices.
It's all about best practice, what's best for the patient. At the end of the day, we're not a licensed dual diagnosis. We have very well-equipped staff, but if someone has a legit presenting severe mental health, we'll refer them up. Go to another facility, maybe a psychiatric facility that can really help you with that and get that stabilized. And once that's under control and that's managed, come back to us, and we'll really help you with those coping skills and that substance use disorder that's behind the mental health piece. You don't want to just take everybody in. Not everybody's the right fit. Every person that calls me, any referral source that calls me, I say, tell me a little bit. You don't have to tell me the name. How are they presenting? What are the issues? What's their history? Are they violent? Are they suicidal? Have they been in treatment before? And you figure all that out, and then I bring it to the clinical team. I'm not a clinician. I bring it to the clinical team, and they'll really dig through it, and they'll talk to the referral source, and oftentimes we're able to help most patients, but once in a while you want to make sure that they're in the right place.
And obviously you don't want to bring somebody into an environment where you've got a lot of people that are already at different stages of their recovery and have that person disrupt that house, if you would.
Yeah, we could manage that. The biggest thing is what are we going to do to give this patient the best chance of success? That's all I care about. All I care about is any call I get, any person I meet, how can I point this person in the right direction? It's not always Gosnold. How do I point this person in the right direction to be most successful, to get the tools that they need to be successful? And that is good business. That is being a good human. That is doing the right thing. And I believe that a lot of people feel that way and behave that way and have a high standard of ethical practices and best practices at Gosnold. And that's what it's about at the end of the day, helping patients, helping families, helping the community. But it's cool because we have all those options at our disposal, and that's really good to be able to see someone through it, because sometimes it's segmented and they got to go from here and then they get to move there, and we'll send them to Florida or in California. And there's great programs there. I'm not knocking them, but why? They're going to have to come back sooner or later. You might as well have them, half hour, an hour away, 2 hours away. You can still see them on the weekend, and slowly they can go visit and come back. They got a court issue or a family event, they can go, maybe even with a companion, bring a recovery coach with you, and slowly you reintegrate them back into the society. You can't geographically cure this problem. You can send them wherever you want. They're probably going to come back. Or they say oh, I moved to California, but the problem was I brought me with me. So now the guy's a mess in California, and he doesn't know anybody there. You get someone stabilized, you get them in treatment, you give them the tools that they need to be successful to help them deal with those demons. Some call it a spiritual malady. Some call it an emotional unbalance. Some call it an undiagnosed mental health disorder or whatever it is. But the key is, this is how people stay in long-term recovery, regardless. If they're happy, if they're sleeping well, eating well, they feel like they have purpose in life, if they're generally content, and content has nothing to do with outside stuff. Don't matter if you got the girl, the car, the job, you could have all those things and be miserable. But if you help a person find a way to be happy, have purpose, to smile, to be okay with themselves, to be able to sit comfortably in their own skin, then drugs and alcohol have no power. It's almost laughable. Why would I do that when I feel good? And if they're having a bad day, they can usually look at their situation and say, I haven't been to the gym. I haven't been to the meeting. Man, I didn't see my therapist last couple. Because they got these tools in place that have helped them find health and wellness. And usually when they're off,
they're missing a segment of that treatment plan.
That's right.
Right. Mm-hmm.
And if they buy into it, so the goal is you want to feel good. Drugs and alcohol do two things for you. They either help you feel good or they help you not feel at all. Either way is a desirable result for someone who doesn't feel good about themselves. So if you can find a way to be happy without drugs and alcohol, then drugs and alcohol lose power. So all you can do is hope to wrap them up in enough supports for a long enough period of time so that they get a positive effect from it, and then they buy into it. They go from not knowing what to do, maybe broken, maybe hopeless, to like, I'll do this because you told me to, wow, I'm doing all these weird things, and I feel good. Whoever thought I'd be praying and meditating? Most powerful thing I have in my life today. I talk fast, I run fast, I'm a hot mess ADHD case. Someone taught me tools early on that when I need to get away and be quiet and put the phones away, I can take a deep breath. I can change the tone and speed of my voice. I've been taught how to calm myself down. If no one ever taught me that, then it would be alcohol or medication or marijuana or something, because early on it does work, but it turns on you. So how do we find healthy ways to deal with the anxieties and stresses of everyday life?
So it's kind of recognizing the triggers that are going to maybe take you back and not letting those triggers be pulled.
Right. And triggers is like a funny word with me because I believe, we can only hide them and protect them for so long, right? If money's a trigger, what do? You never work again? Right. Spoon's a trigger. What do? Eat cereal with a fork? You know what I'm saying? You can only hide from liquor stores, but there are emotional triggers, and there are triggers early on that you don't want to be around any of those old haunts. But in reality, if you solve that emotional unrest and you help a person get into recovery, and that light comes on, then they just whistle and walk by a liquor store, and they could care less. Because that's nothing in there for them anymore. They'll whistle on the way to the gym walking by a liquor store,
Okay, so believe it or not,
no!
we're at the end of our program again. This has been fascinating. Give us how to reach Gosnold, how to reach you personally if need be. So give us the numbers and the name.
Yep, so gosnold.org is really the best place to go. It's an interactive website. You can inquire there. All the phone numbers are there for all the different sites. My personal phone number, if someone wants to call me, I'll put it out there, is 508-274-4477. We're here in Brockton, so you got to know the Brockton direct number is 508-584-5190. And go to Facebook. Please go to Facebook, like us, and share us on Facebook. You'll see the cool stuff we're doing in the community. Okay. We're always putting posts up there. And
Kevin, we're out of time.
Thanks,
on behalf of all of us for A Deadly Silence, Kevin, thank you for being here.
Pleasure.
And thank you for being one of our initial sponsors back in WVBF 1530 in the AM dial.